Hello friends, I am Dr. Asha Devi, Obstetrician and Gynecologist. Today, let's discuss one of the commonest questions being asked by every pregnant mother. What is the ideal position for sleeping during pregnancy? In the first 3 months of pregnancy, the womb is still inside the hip bones, which means the womb is still not come outside into the tummy. So, during this period, you can choose to sleep in any position which is comfortable for you. But as pregnancy advances, there are certain restrictions in the positions while sleeping. Why do we say sleeping towards the left side is the ideal position during pregnancy? So to understand that, let's talk a little bit of science here. In our body, there is a large vein called IVC. The purpose of this vein is to collect blood from different parts of the body and to supply the heart. This large vein is present on the right side of the body. So, when you are sleeping towards the left side, this large vein remains uncompromised in performing its function, which means that this is not compressed by the growing womb. And additionally, the liver is present on the right side and the right kidney functions efficiently when you're sleeping towards the left. And this helps in tackling your swelling which can develop in your hands and legs during the course of your pregnancy. Can one sleep on the back or towards the right? What happens? If you're sleeping on your back, what happens? Like I said, the big uterus is going to compress the vein. So if the vein is getting compressed, the blood supply to the heart is going to get compromised. And if this happens, what can happen to you? You can develop a lightheadedness because your blood pressure has a tendency to fall down. Apart from that, you can develop some indigestion problems and also backache. So it's generally not a good idea to sleep on your back as the pregnancy advances. Now, coming to whether you can sleep safely on your right side. So the commonest question pregnant mothers ask is, it is very difficult to constantly sleep in one position, that is towards the left. In course of time, towards the night, their body starts aching, especially the bones start hurting them. In that situation, you can for a few hours, a little 1 or 2 hours, you can go towards your right. But as much as possible, if you're sleeping towards your left, that would be the ideal position. But definitely you should not be sleeping on your back. Another common doubt pregnant mothers have is they sometimes unconsciously turn over and sleep towards the right or sometimes even on their back. So suddenly they get panicked whether this is completely unsafe to the developing baby. This is a very common thing every pregnant mother does. When you're trying to sleep towards the left consciously, sometimes you may possibly roll on your back or to your right. As much as possible, when you realize that, go back to your left-sided position. Otherwise, it is absolutely fine. Don't get panicked or worried about it. Now, let me share a few tips on how to make you sleep comfortable during pregnancy. Avoid laptops, mobiles, and TVs for at least 1 hour prior going to bed. Why? Because these devices can emit blue waves which can affect your sleep pattern in your brain. Avoid coffee and too much of water after 7 p.m. in the night. This will help in reducing your night calls while you're sleeping. Try and use cushion pillows when you're sleeping. Maternity pillows are also available, but they might work expensive for some. Any type of flat pillows or cushion pillows might also suffice and help you fall into a comfortable position during sleep. Try and do simple exercises at least 1 hour before going to sleep. This means that simple walking or yoga, this will help in relaxing your muscles and giving you a good sleep. Hope this video was helpful for you. Thank you.